going to roll Becky in here, who is our
Okay.
next guest, who is, oh, darn, Becky, I asked you to email. Um, so Becky Prevey is the executive director of Association on Aging. She is a powerhouse of an advocate for aging and disabled humans in New York State and nationally. And the Association on Aging in New York is a membership organization representing the 59 area aging agencies on aging in New York. The mission of the association is to support and enhance the capacity of New York's local area agencies on aging and to work in collaboration with the Aging Network to promote independence, preserve dignity, advocate on behalf of the aging New Yorkers and their families. And prior to joining the association as their leader, she was the director of Franklin County Office for the Aging. And then prior to the Aging Network in general, she was an acute care social worker at Alice Hyde Medical Center in Malone, New York. And I hope she tells one of her stories she told me once, that I know she's a care warrior from one of those stories. Becky earned her bachelor's of science degree from Clarkson and in 2002, and she's received a certification from the Institute for Healthcare Improvement and Boston University of Social Work. Becky's a board member for the I never say this Adirondack Health Institute Hospice of the North County Cornell Cooperative Extension. She sits on many boards, and she's a huge advocate of our Family Essential program, which I dreamed up, a silver lining product of the COVID, that we are in the pilot phase of, and that we work on with her. And I am so excited that she said yes to come to speak with us today on the fifth anniversary of being locked out. Becky, are you there? Because I just
I
lost. Hi. So we call her Becky Andretti. What?
you make me
Okay.
chuckle, Marcella.
You're Becky Andretti. Can you grab? We're just going to do a weird thing. There's a cord in there that I want to charge my. Thank you. Becky Andretti. So, Becky Prevey, who's a data monster. So thank you for joining us today. We know you work mostly in the community, and I know there's a little bit of crossover in long-term care. So I guess our hope with you today is that you can, shed some hope and light and data for us on what is changing on the healthcare, aging, and disability front. Because I know you're involved in. Bye. Say bye to Matt, everybody. Where are you going? Bye. He's got some other. He's got Grammy award winning artists to do now. What? He's not abandoning us. So Becky, yeah. So let's break it down for us because this is a big day for us as consumers in long-term care. And I know my husband's not someone who can actually live in the community, but I know there's all these systems and supports that sort of cross over to the long-term care community. Share with us, like, the three big things that are happening right now, and what your belief system is about how this space is going to continue to change, hopefully for the population that's becoming more and more dense.
Well, first and foremost, I would be remiss if I didn't thank all of you for the incredible work and advocacy you've done, especially on the fifth anniversary of the lockout. And I just want to say I've had the opportunity to speak with Dolores in the past. Marcella, you and I have worked really closely together over the past couple years. The work and the voice you've brought to nursing home residents is amazing, and it should be applauded. And even though a lot of the work that we do through Offices for the Aging is about home and community-based services, we're serving the entire older population, which is inclusive of people that need that higher level of care. And we'll always work with you to try and improve that care. As far as, the work in the aging landscape, I think a lot of things have changed. A lot of things will continue to change. There's a lot of very positive things that we're looking at. But I always start any conversation, and you know this about me, Marcella, with data, is what is the root cause of how we treat the older population and the disabled population? And it's ageism and ableism, and it's learned, and it's something that we see, nationwide. A lot of people aren't comfortable talking about their older years, planning for their older years. But a lot of people also have this complete misconception that the older population or people in need of care are a dredge on society. And when you actually boil down and look at data, because we've made the argument for years it's the right thing to do to support individuals that have needs. But when you look at the actual data about the older population and their contributions, I think that that changes people's views. So just to share a little bit with you from the state of New York, we're fourth in the nation for the 60 plus population. So significant number of people over the age of 60, which is the qualifier for our services. So in the entire state, we're home to about 20 million people. We have close to 5 million that are over the age of 60. We have an additional 4.1 million caregivers, which is also where you sit. So you're talking about almost half of the population of the state of New York is either older or they're in a caregiving position. So why aren't we talking about this with a much larger voice? When you look at the economic contributions of the older population, so statewide, about 36% of the population is over the age of 50. They support almost 6 million jobs. They pay $72 billion per year in state and local taxes. Again, I want to underscore that's over 40% of all taxes that are paid in the state of New York are paid by older individuals. And they generate through wages, salary, and Social Security over $482 billion per year for the state. And so we're using the argument that this is a population who has contributed to our society, who deserves to age with dignity, autonomy, and respect. And we're using that to change the political landscape when you talk about funding. And you've heard me testify many times, Marcella, and one of the things that I like to highlight is, during the COVID-19 pandemic, we celebrated first responders and nursing staff and teachers, right? What makes them any more less valuable just because they're older? And that's really the lens that we try to think through this on. And again, I hate it when elected officials talk about, they, them, older people. It's all of us. You're aging the minute you're born. And the other component to this, which is why I really love working with you, is older people don't just touch the state office for the aging, right? They touch every other service infrastructure because they're part of families. And so what we do in school systems and educating younger people, what we do in our middle years obviously impacts our longevity. And those are all things we're really trying to change the dynamic on, is to talk about how valuable the population is and how it is the right thing to do morally, to make sure that we have a robust system that serves people where their needs are. And I think we're getting better at that. Unfortunately, at the same time, and you and I have talked about this, we're actually losing licensed skilled nursing facility beds, which is an extremely difficult thing for families. Here in upstate New York, we sometimes send people 5 or 6 hours away, or unfortunately, sometimes we send people to other states, which is just unconscionable. And we have to do better. So, a long-winded answer is we're trying to change the dynamic, and we're just going to continue to fight and advocate for equality for the older population and people with disabilities.
And changing the dynamic, right? So my other ride or die buddy in my life is my mother, right? She's 95. And she worked in this space for a long time, 70 years. And the question is it ever going to change? Like, are we ever going to, as a human race, right? So if my husband or anyone's person is disabled or aging in our society, the stigma is they're not contributors, even though your data shows they're 40% contributors. And the money that's being flung around and the budgets in order to deliver that meal, not deliver that meal, get the railing built in the house so they don't have to go into an institution, or the extra therapy they might need in a long-term care community. The money cuts toward dignity, care, and human right to exist at their highest level of functioning. When you think that this disabled aging person provides 40% of that money that they're duking it out over in an Excel spreadsheet, it doesn't make sense. So in your advocacy and your bold data, that's very powerful. what do you think is the central theme here about the leaders who have the power of the pen and the money that is blocking them from providing the supports on those waiting lists that you have upstate and the staffing ratios? I was talking to Kim earlier about the new staffing law that is in effect right now. That's not happening. And the powerful lobbyists are looking to rescind it. And their argument is, well, they can't even pay us right on the dollar for the Medicaid. And now they want us to invest in billions of dollars into the staffing to help somebody. So, Becky, thoughts on all that? I know that was a lot, but.
Well, I think they're all really salient points. And in my conversations with Senate, Assembly, the governor's office, our national partners, is we value and pay for things that we care about. And I think the ridiculous underfunding that we've seen in the Aging Services Network for decades is really a reflection of, people somehow losing value as they get older and not having the same level of voice. And so, a lot of the work that we do in the state of New York is we talk about the Medicaid problem, right? We have a very significant, $100 billion plus Medicaid budget. And then if you look at the New York State Office for the Aging budget, we're actually less than 0.1% of the overall state spend, even though 43% of the taxes are paid by older people. And I think that statistic is really eye-opening when we do a lot of the work that we're doing in Albany, to say, if older people are paying for our healthcare system and they're paying for our educational system and they're paying for our roads and bridges to be paved, why the heck are we telling someone they can't get a home delivered meal? And part of the data that we really use to leverage that in a way that we could fix this Medicaid system so Medicaid could actually pay appropriately for people with higher needs is to invest in Medicaid prevention. And Medicaid prevention is not this obtuse idea, right? We know the people that are served through local offices for the aging, because we serve non-Medicaid eligible individuals. And again, to give you kind of a way to rein this in, you can only make about $1,800 a month as a single individual and get Medicaid. So if you're making $2,100 per month, you don't qualify for Medicaid, but you can't privately pay $45 an hour for a home health aide. That's where the Office for the Aging subsidize those services. And those are services like home delivered meals, like a home health aide to come in, someone to take you to the grocery store, information on health insurance, counseling, transportation to medical appointments, comprehensive case management. That's all is provided through local offices for the aging. Our average client, so if you took everyone we're serving and we looked at who they were, that average client is an 83-year-old low-income female who lives alone, has 4 to 10 chronic conditions like diabetes, congestive heart failure, and needs hands-on assistance with at least 4 ADLs, right? So if you're just looking at that individual on a piece of paper, they could technically qualify to go to a higher level of care. We're able to serve them in their home and community on average for 7 years for less than $10,000 per year, versus, nursing home rates of $140,000, $150,000 per year. So again, how do you right size the system? We make sure that there's resources available for individuals with higher needs that may need to be in a facility setting, invest the money to give them an appropriate level of care, and prevent people in the community that can be maintained safely in the community, serve them through us, keep them off Medicaid, and you solve this systematic problem. And that's really what we and will continue to try and do through the work on the Master Plan for Aging, through the work that I do with the 59 offices for the aging. And I use this example, I think it's a good analogy. In my children's school district, right? They have counselors that come in and talk to kids about never vaping, not using tobacco products. Why do we invest in that? Because we know the long-term health implications if we don't prevent those types of things. Why we don't do the same thing as people get older is always been a mystery to me. Like, why aren't we targeting people in their younger years to make plans, to address some health concerns, to make sure that there are services in place, so we don't get to that crisis point. And then the system, our hospitals and nursing homes, had would have the resources to actually provide an appropriate level of care.
Right. And I think what you're saying that's really important to me, and I'm hearing it, I've heard it before, but I'm hearing it a little bit differently today. I think because I'm obsessed with, as you know, with solving the problem, is that it's about connecting the dots for all the stakeholders. And we talked about this a lot in the master plan for aging, whereby everybody seems, or I don't want to make statements that are just like blanket, but everybody sort of works in a silo, you know. So to connect the dots and the narrative for the hospital, the nursing home, the benefits of, like, even something, and this is just a obviously selfish example of the benefits of having the family caregiver in the nursing home, like that has to be spelled out for an operator. They're afraid of us. They're thinking liability. They're thinking, you know, all kinds of things that we're not thinking. We're just thinking, you know, I would like my loved one to have a clean diaper during his lunchtime, you know. Like, so it's connecting the dots with all the data, Becky. I think that you're so brilliant at in your work. Um, and if it's the budgets they're looking at or where they're going to cut, like, can you cut on the linen guy that's triple charging you? Can you cut on those staffing agencies that are triple charging you? And do we know, and this is a provocative question, that triple charging sum of money that's going out of your pocket, is that coming back to you because you own those five staffing agencies? That's, oh, Marcella just said that. But yeah, like that kind of money flow. What are your thoughts on that in terms of infrastructures that could be created? And I know are through your work, to connect the dots for people. Because do these leaders understand it hasn't happened to them yet? Maybe it happened to their grandma, maybe it happened to their cousin, you know, all those thoughts I think are so impactful for moving the needle. What do you think?
I couldn't agree more. And, you know, there is a lot of conversation about Medicaid. Um, we serve non-Medicaid eligible individuals, but we have an opinion on Medicaid, which is there is not enough transparency on where those spends are. Specific to, you know, skilled nursing facilities, to MLTC plans, who's getting paid what money. I will tell you, in our network, because we are a direct service model, and we don't go through that third party system, every one of our dollars is accounted for. So we know exactly, you know, this 1 hour of care was provided, this is the charge, this is the payment. I wish the state would look at similar systems under Medicaid, because I think, you know, there's all this talk about global waste, fraud, and abuse in the consumer directed program, which was largely targeted this session. And as of yesterday, we were informed only 10% of consumers have been enrolled, which means we're going to have over 200,000 people who are older or disabled that could potentially go without care. I'm not sure why the state chose that one program to take a scalpel to, but doesn't look at the global MLTC issue and payment mechanisms. And what's really unfortunate, Marcella, is that, and you know, you understand this, there are many skilled nursing facilities that try to do the very best job that they can, and they're very much above board. We have bad actors that have put a really poor feel out around skilled nursing facility institutions. And I think as you see more of them get privatized and more of them become for profit, it's even more opportunity for waste, fraud, and abuse versus good quality care. And, you know, what's frustrating for us in our network is having to tell people we can't serve them. What's really frustrating on the skilled nursing facility is that when people necessitate that level of care, or a loved one can't provide care in a home, we are limiting resources for those individuals. We're sending people great distances away. And at the same time, I don't understand how the stories that I hear and you hear and families share about the care that their loved one is given, if that happened in a community-based setting, you would literally be charged with elder abuse, right? Like you can't leave a loved one in soiled linens and soiled clothing. They need to be fed. Yet because it's in an institutional setting, all of a sudden those things kind of fly out the window, which is just completely and totally unacceptable.
It's fascinating to me. We had a little bit of this conversation earlier with Kim about that part, right? So the impact of, and I feel like this, and I can say this on the fifth anniversary, like we've experienced the past 5 years, just everybody fighting each other, and the families and the residents and the vulnerable and the advocates and the I'm going to say caregiver advocates are in the middle of this, and we're the consumer, right? So, but we're also the solution, right? So we're bridging the care on the front line. We are, like, I was that person in the community that needed to make that decision. And had I known about ISEP and all the things you guys provide, I probably would I have made a different decision about institutionalizing my husband. I don't know. I don't think so, because he has a very rare discourse. But and I needed help, and I was exhausted, and I was going to go first. Your data about, the caregivers going first, and then your partner, collaborator Greg, talking about caregivers suicidal. What is that suicide data point? Like 40% of people commit suicide or because of the exhaustion. But all that to say, the the idea that when we are met with the basic question of giving somebody what they need for their dignity and their human right and their civil right and their disability right, and their resident right if you're in a facility, and their right to be not abused in a community setting, to your point of the elder abuse, police coming, police come to nursing homes. Like, it's amazing that the operators are still crying for the same thing when the frontline impact of care hasn't gotten better 5 years later. In fact, in a lot of ways, it's much, 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 much worse. And I think the question is, for consumers exhausted, but we're never giving up, is what do we do? Where do we go? We have developed the Family Essential program, as you know. You're a huge champion of it, and I'm honored to work with you and all the wonderful things you're helping us, make it grow. But that's one solution of 10 that needs to happen. You have the ombudsman program. I'm just trying to give you prompts to jump in, Becky. So I know, because I know you could back up data with whatever philosophy thing I'm giving.
Yeah, and that's the frustrating part, Marcella, that we're in 2025 and that we're still having to have this conversation about basic human rights and basic human dignity. And I think, it's so multifaceted. So it has to be top down, but also bottom up. So I look at the incredible work you were doing doing. That's our bottom up, right? That's grassroots. That's, boots on the ground doing the work at the same time that we do the top down approach, which is really targeting elected officials to talk about this, to understand this. And what I find fascinating, because I do a lot of lobbying, I have never met with an elected official that didn't tell me a personal story about caregiving, because we're all part of families. And, families are not this wonderful Hallmark Christmas card. Families are very difficult. And what I find amazing is trying to get the connection made between that personal lived experience and the brokenness of the system that we work within. Right. And how do we change that? We change that through funding. We change that through legislative policies. And that's where our work will continue ongoing. I think, we touched a little bit about the working caregiver issue. And what I find fascinating is I meet with businesses very often to say, you really need to have an employee assistance program that targets the working caregiver. And, if I go to my employer and I say I'm a victim of domestic violence, or I have an alcohol or substance abuse issue, they instantly know how to pair me with my employee assistance program. When you go to your employer and say, oh my goodness, mom fell and broke her hip, I have no one to cover for me, I don't know what to do, there's not a lot of education on how to support the working caregiver. So those are some of the things that we've put forward in legislation to make that part of an employee process. But what catches their attention is the huge economic loss for employers by working caregivers that are missing time at work. Almost 10% post-COVID have left the workforce entirely. 40% indicate that they are less productive at work or have taken time off. And then when you look at the mental health component, so we know from our own New York State data, from a lot of work that we have done, about half of all caregivers don't self-identify. So they say, I'm just a wife, I'm just a mom, I'm just a friend. So they don't even identify as being a caregiver. Then, if you take a deeper dive into how they're doing emotionally, they have 6 times the suicide rate of the general population, which is atrocious. Over 43% of them have one adverse mental health issue based on their caregiving journey. Over 50% of caregivers are using food in inappropriate ways to cope. I think all of us have been, guilty of grabbing a bag of potato chips instead of dinner when you're in a caregiving role. And they are not there for the remainder of their family because the caregiving burden is so significant, right? Then you add on to that, and you've been so beautiful about sharing your story, Marcella, is the guilt that a caregiver has when they can't access the services at home, or if someone's care exceeds what you can provide in a home or community-based setting. And I think in one of my earlier conversations with you, it was a light bulb moment for me, because I'm always talking about home and community-based services, and they absolutely serve a purpose, but so do skilled nursing facilities. And we can't just pretend that those higher levels of care don't exist. And in my previous work as a hospital social worker, I learned a lesson that I've shared with my kids from the time they could really understand, because I had so many patients whose family would say, my mom made me promise to never put her in a nursing home. And then mom has a catastrophic medical event that can't be managed at home. And even though in that moment, the individual says, yes, I know this is where I need to go, the caregiver guilt and burden that is carried for the rest of that individual's life has long lasting, meaningful impact. So again, we never want to talk about this, but if you ask my kids, if something happened to mom and it was going to be too much for us to take care of her, they know my wishes are to send me to whatever facility can meet my needs and not have any guilt about it. And again, I think it goes back to my first point. No one wants to talk about the aging process or getting older. But statistically, you have a 1 in 40% chance of having a catastrophic medical event at any point in your life. And people just don't want to talk about it.
Because they're in denial. And it's a denial. I call it the informed denial. Sorry, I'm probably there's getting back. The informed denial thing, like of our own mortality, that we're going to get sick. 100% of us are going to get sick and leave this world. None of us are getting out of this alive. What that looks like, we don't know. It's the unknown. When Bob got sick, he just looked at me and he said, "You haven't met Bob in person, but he has a sense of humor and spirit about him." He just looked at me and said, "Well, at least we know how I'm going. At least that's clear in our plan of life." And it's like, okay. And that gave me a lot of peace, because in that moment I saw his acceptance of the situation, because that's why I married the guy, because he's just Buddha Bob, we call him at this point, 9 years into a long-term care facility. But the guilt part of it is interesting, because I actually get, when people say, "Oh, your husband's in a nurse," people project this awful thing onto you as if my life is a tragedy. And, my life is a joy. I get to meet people like you and other family members and help all these just people that our society think are disposable. And they're walking encyclopedias of 100 years of history. It's an honor. And I say all that to say to the next point of like, it's not helpful to say to someone who has a loved one in a nursing home, "I'm so sorry." It's like, why? I'm not sorry. I'm only sorry for if the operator's not operating at their high, best level that they can do. And we can do better on the front line. We can do better. And it doesn't take much, like the thing that you always talk about, like compassion and dignity. And, I told someone the other day, I do 4 things before I even get to my husband. Mr. Joe likes his iPad. There's a Japanese resident loves for me to say sumisan, which means excuse me in Japanese, because I lived in Japan at one point in my life. So it's like, it doesn't take much. And that might carry a resident through the rest of their day. So what were we talking about? I got distracted by your story of being a hospital, about if you had to go to a long-term care facility, but you're an informed consumer and professional. So, how do we get that consciousness elevated, and I don't think it means that you have to sit all day and think about when I'm going to die. Like it's a depression thing, or when I'm going to look, but it's, what do you think? I have to unmute you. You're muted. How did that happen? I don't know. It's 5 years later.
There, I'm back.
Yeah, you're back. What were you saying? Sorry about that. We want to make
Um,
sure we got it
I,
laid
I
down.
just I think people just being educated and people knowing to have these conversations. And to your point, Marcella, when I first met you, I think one of my follow-ups after one of the meetings was it was so apparent how you were treated. There was an instant, we were in a large Zoom. There was an instant kind of voice change in the Marcella. Um, and both of us were like, what just happened? Because that is, the work you do is incredible, and your personal journey is not something that you need sympathy for, right? Like it's your life journey with Bob. And, to your point, you have joy, you have quality of life. A lot of people do. And why are we placing judgment, right, on any other person? We don't do that with anything else in our lives. So why do we do it when someone has an older loved one? And again, this thought process that people that need higher levels of care don't have quality of life, that's untrue as well. And that's where I think if we did a better job in skilled nursing facilities, people would have an even better quality of life while residing in one. And, some of the things you've shared about your mom and how she's thriving, right? It's a model we need to pay attention to. And the frustrating part for me, and people think I'm overly dramatic when I say this, but if I treated an animal in my backyard like some of the stories I hear from family members of how their loved one has been treated in a facility, I would be arrested and I would go to jail. We need the same, and I can't remember where the nursing home was. It wasn't in New York, but a nursing home was actually charged with murder for maltreatment and not meeting the needs of an individual. And again, we have some of the best medical facilities in the country in the state of New York. There is no reason that the quality of care in skilled nursing facilities isn't miles beyond what we are now. And my hope is eventually there won't be any of these horrific stories. And you and I have talked about this. The same thing happened in the disability institutionalized communities until Willowbrook. And that really, it was an opportunity to shine the light on what was happening. And I think, there needs to be much more surveillance and enforcement at all levels, right, to make sure that we're increasing quality of care. And I also think we need to do a much better job about infusing home and community-based services with qualified, effective staff that can support people in the community that want to remain there. And the direct care worker shortage that, the facilities are seeing are no different than what we see in the community, where depending on where you live, you might not be able to ever get a home health aide because one can't get to you. And we pay them like garbage, which is, again, when we talk about we pay for things that we value, that's just showing that we don't value those hands-on caregivers. And they're the most important part of the care team. So why aren't we supporting them in the work that they do?
And they would love the job. There's this narrative out that people don't want this job. The operators are like, we can't get staff. Why can't you get staff? Like if you treated them better, if you gave them the right amount of patients instead of 20 a day, or, they don't come back after they see that they can't do what they need to finish their shift. And that's like what we're going to go loud, because there's all these provider narratives going on. We did the families now to ask for more Medicaid dollars. Okay, I get that formula, but when you invest in your care that you're selling, which means investing in the staff, like we'll be happy to scream for you. But even at this juncture with was it 82 cents on the dollar is what I read, like where we go, where families get very uncomfortable is like, well, what are you doing with the money now? Like, because there are new wonderful, and about them, the trainings of the CNA trainings that different people are providing for free. And, it's not true that the new people don't want this job. It's that they get the job and then it's overwhelming for them. They don't have the systems and supports and they leave, so the retention part isn't just about the money of what they're out. Like if I had a nurse say to me, you could pay me $1 or you could pay me $1 million a year. I'm a nurse and I took an oath and I'm going to care for those residents. And that's the philosophy that needs to be imparted to the next two generations, which I've met young aides that love it. They're like,
Yeah.
one aide, a couple, I forget what, she just was beautiful, angelic look, and she just said, oh, it's amazing how there's this whole population of people that exist and society doesn't even know about it. Like, she was honored to be in the space of helping the resident. That next generation, like your daughter, they do exist, but the infrastructure that we're going to put in place, which to your point includes paying them better and rearranging the money like here and there, and these people that make so much money at the tippy tops. Like, and sometimes recently, in this journey, I'm like, my husband lives in a Medicaid hotel, I mean, that's my life. He lives at a Medicaid hotel. And when I think about how much money people make off of the disabled and aging in a long-term care facility, my blood boils, because it's like, you know, any thoughts, Becky? I want you to cut me off now, because I'm like, now I'm ready.
No, I mean, we're in lockstep about this, and I can't remember if it was this budget testimony, or the one in the city in the fall. But I literally said to the legislature, the fact that you have people come before you and wait 12 hours to get 3 minutes to say what their personal story is, and you get a sympathetic head nod, but then you never see anything change, is atrocious. And they don't like hearing me say that, but I'll continue to say that. And what's frustrating for me is, so, in the advocacy world, it's personal stories. Like, tell your personal story. It resonates with people. So we have people come to Albany, and they testify about their personal story. And I don't know about you, Marcella, but I don't like going on public record and talking about my bodily fluids. People put their bodies out there and do that on a televised media platform, and they're doing it because they're trying to affect change. So that doesn't work, right? That's been happening for years. It doesn't work. And so then will show us the data. So we go and we show the data. We show the cost savings to the Medicaid system, how you could right size the services. That doesn't work. So then you pair the two together. Or you do a letter writing campaign, or, we just had over 100 older individuals that joined us in Albany for a rally day. You get the attention for about 30 seconds. And then, it's moved on to something different. And I think until we really coordinate and target ageism and ableism, we're not going to see that change, because that is the root cause of the lack of funding, of skilled nursing facility residents becoming invisible to the public, which unfortunately that is what happens. And we have to get away from this thought process of, oh, that's just them. It's collectively our entire state and our entire country. And we should look at other states that do this work better, because there are a lot that do, and there's other countries that do a much better job. So, I don't want to be negative, because I think like today is such a celebration of the work you guys have done, and how effective you have become, what the Essential Visitor Program is. I'm so excited that we're partnering with you on it to expand it. I want to, you as well. I want to see it in every facility. I think it's absolutely fantastic. I want to see continued changes to the Ombudsman program. So talk a lot about the Ombudsman program. It's predominantly run by volunteers. And you understand this, Marcella, because you know what it's like to talk with administration at a skilled nursing facility. We cannot expect a volunteer to be well-versed in patients' rights, in how to file an appeal, on how to argue for additional therapies. That needs to be a professional paid position. And then, Department of Health needs to actually enforce surveillance measures. And we need to deal with those skilled nursing facilities or those licensed home care providers that are the bad actors, in order to support those that are doing really good work. And that's what we're going to continue to do.
And you do it so well, and it's like your reach is so amazing. And yes, out to the universe, the Family Essential program will be in every facility in the next 3 years. We're moving toward that. And it's Care Partners, what you made you made me think of care partners. Everybody in this moment is a care partner when you have a loved one or aging person that becomes disabled, or in my case, my husband has a chronic illness and needs total care. And it's a very private moment. It's a tender moment. It's a grief moment. It's emotional. And when there's practitioners on the front line like yourself, and other advocates that get it, I was saying this earlier today. I know the family consumer feels better, because when you're in this isolated journey where, Bob is 0.06 part of the population, that if, that people feel some sort of way about, um, him being in a bed and alive and he can't move and he can't talk. And I think there's some people that might think he's a burden, because of what it costs. We're up to $1 million for Medicaid paying for him to be alive for the past 9 years. $1 million. And I asked a legal person today, do I owe that back? Do we pay that back? And she's like, well, they don't take it all back, but when he dies, they'll send you a thing and then you negotiate. So it's like, so this is what the system is for someone who worked for 30 years and to your data of 40% of the population, the money flows off their disability and their aging deal. And it's disgusting. And other cultures, they honor the elders, they honor the aging. It's like they sit at their feet at home. I wish I could do that, but anyway, all that to say that we're not giving up, and it's people like yourself that keep the family consumer that is formalizing their role in this space inspired, that there is a seat at the table for us. We'll help you create those infrastructures through our lived experience, our evidence informed experience that I learned from the master plan of aging for aging. And earlier when you said, "Oh, it's Marcella," I thought you meant when they were doing the caregiver. Oh, it's Marcella. When you sit and you lobby and they go, "Thank you for sharing. Thank you so much for sharing." I don't know the best way to answer a caregiver like myself or an advocate, but I do know that we can continue to expand the consciousness of what this moment is about, and know the resources that are available. And I know through your association that there's so many resources that are available. And when we lay this down in post-production, we'll have all those attached to this recording so that the consumer knows, where to go. That's what our Family Essential program is as well, is another tool so that people can get going in the right direction for whatever that need is in the moment. Which a lot of it is they don't know where to go, what I mean, or how to feel or what to say. So it's really important to have stakeholders like yourself that have had the experience, like in the hospital setting, and you get it. Are you allowed to tell the story though of the funeral you had? Is that private? Is that breaking HIPAA?
No, I didn't know which story you were going to reference.
The hip.
Quite few.
But it's about someone matters, like they're just not a body that you throw into. I've been lately saying nursing homes are Manhattan mini storage for humans. I mean, it's like, that's a horrible thing to say, I know, but not really, that's how they're being treated. So yeah, the hospital story of the funeral, I love it. It'd be
well, and I think the takeaway is also, Marcella, the story I'm going to tell is, it's unique in the sense that I'm going to tell it, but there are a lot of people that work in facilities that have that level of passion and caring for every patient that comes through the door. So I just want to lay that framework that a lot of us that have worked in these positions in health and human services really, really care about the people and families that we work with. And so the story that I shared with Marcella is I had an individual that came in who had passed away, and the family lived a significant distance away, where, in upstate New York, it's very rural. Family had to travel. And the individual was sent to the morgue because the emergency department didn't have any beds left. So when family arrived, they wanted to see their loved one who had not been taken to the funeral home yet. And I could not in good conscience bring this family to, a very dark, depressing morgue area. And so I coerced some of my friends that worked at the hospital to actually take the body to our chapel, which was next to the intensive care unit, but 3 floors up. So again, smuggled this gurney to the chapel because I wanted that family to be able to have a final goodbye with their loved one that wasn't cold and clinical. And, I think I shared this with you, Marcella. They were a lovely family, but they decided to really hold a service while in the chapel the entire time I was pacing outside trying to figure out how I was going to get the individual back downstairs without getting caught. So I tell that story because I wanted that family to have the best experience that they could have, but also to highlight there's a lot of people that work within facilities that really care about you guys and the work that you do, and they take it home with them. And I think that that's something we don't always highlight or talk about, Marcella, that there are some really incredible people that are doing this work that care. And, lastly, to your point about doing better, if you look at how we talk about the older population, the vernacular really matters. So everybody refers to the baby boomers as the silver tsunami. Well, a tsunami comes in and devastates everything, right? So it's that type of language that really matters. And, we no longer use the word elderly or senior citizen. We say older adult. And this work is not complicated. I had my son's hockey team in the car with me. My daughter was probably 5 years old. And one of the hockey kids said, "Look at that old lady." And Emma, without being prompted, piped up and said, "That's an older person. Don't call her an old lady." It's not complicated. It's really about how we talk and how we value. And I think a reflection of society is how we treat our most vulnerable. And we've got to do a better job.
Yeah. Serve the sick is what the Beatitudes say, right? Like you serve the sick if you're into the Bible. I'm not that into the Bible, but I do know the Beatitudes where it's the biggest honor that we have is to serve the sick, and you don't have to be a doctor to do that. So wow, what a great conversation that was supposed to last for 30 minutes, and it's all we could talk for hours, and we will continue to do that. And I'm just amazed at the work that you do and continue to applaud all the innovation that you're going for and the lobbying that you do with our state legislature. And if we give up, it would never happen. That's what I tell the families. Sometimes they get afraid to advocate because they feel like it's not changing anything, or, they're afraid of retaliation. And I always say, could you imagine if you didn't say anything? Could you imagine if you just said nothing? Like nothing changes, and to sort of put a button on the theme of like the 5-year thing is, in a lot of ways it's worse on the front lines. But I like Dolores's insight of the silver lining of all the innovation that's happening, the beginnings of things. That wouldn't have happened if there wasn't a catastrophe like this. Unfortunately, many lives were lost. But we have room to grow, and it takes like care warrior soldiers like yourself and a lot of the people that I know, that I know through you, to make it happen, especially with our Family Essential program, which I'm obsessed about. So it better be in the master plan for aging. I hope it's somewhere in some piece of the page. So we hope it's there. But is there any final thoughts you'd like to put forth as we wrap up? Because Natalie's over here giving me 4 minutes. So that you'd like to say, Becky, for anybody that's listening, and as we do a post on this, anything else you want to say for us? Yeah.
I have to say how much I applaud every family that was impacted through the COVID-19 pandemic, the cessation of visitation, the post-traumatic stress that all of you deal with on a day in and day out basis. And I just want to say thank you to every caregiver that is on this path and is providing and putting themselves out there to support your loved ones. Many times I think people feel invisible. I will tell you a lot of people see you and have your backs. And just, I personally applaud you, Marcella, for you sharing, your personal story, sharing Bob with me. It's been amazing to get to know both of you through, what, again, silver lining, the master plan for aging, I think is the reason we got brought together. I now applaud and support all of the amazing work that you're doing. And on the fifth anniversary, I just want to let all of your listeners know how much they're valued and how much they're seen by really the majority of the public.
That's helpful because we know we screamed. I know during COVID when I was trying to get in, I got this random email from somebody like Department of Health. And I was like, are they listening to us? And this random email came back and said, yes, we are. And to this day, I asked somebody, I can put this somewhere. I don't care because this is kind of fun because newsflash, I did invite Cuomo to come today. And maybe he'll come next month. Because I want to talk to him about if he becomes mayor, what you gonna do? What are you gonna do for the nursing home residents? But I asked who sent how did you guys hear us? And this random email came back and said yes. And then many months later asked well, who heard us? And then we got this email back that said everyone. So it's like I use that, and then it's with family advocacy. People are always afraid of retaliation. I'll end here. Is that I tell everybody I'm the poster child of nothing's happened to Bob yet. So if because it's irrational on the front line, you get us scared, and people are tired, and all that good stuff. So thank you again, Becky, for coming, and for those that are been with us for 3 hours, we'll do a follow-up post distribution that will have bits and pieces of the 3 hours as well as all the resources we've mentioned that will be helpful to family caregivers both in the community and long-term care facilities. And thank you for acknowledging the PTSD, Becky, because I have it in spades. And you asked Matt, who was here earlier, and even Natalie, who's here now. I was all over the place. I parked my car in Midtown and I'm running down Second Avenue. I'm like, what is happening? What is happening with me today? It's not 5 years ago where they just told you that you couldn't, see your loved one. So there's just a closing thing I wanted to read, if you'll indulge me. You see me with all these papers. But it's about how, and Becky, you can hang on for this, how I didn't know what to do today, 5 years later, because it is 5 years later. And 5 years ago, we were screaming into news cameras and we had hundreds of families, and the rotation of families in nursing homes, it's a rotation of every year and a half or two. We're in our fifth generation of families for our 9 years. And I just wanted to cap it up with this little testimonial that